Hello, this is Dr. Serena Satcher, and I'm going to talk to you today about lupus. We had a number of questions about lupus, and I often get asked, what is lupus? The Lupus Foundation of America says that lupus is a chronic long-term disease that can cause inflammation and pain in any part of your body. In other words, they're talking about systemic lupus, and it's an autoimmune disease, which means that the immune system, the body system that usually fights infections, attacks healthy tissue instead. It's most commonly affects the skin, the joints, organs like the kidneys, the heart, and the brain. Tune in for the next question that I'm going to talk about in the next segment, which is about the different types of lupus. Hi, this is Dr. Serena Satcher, and we're talking today about lupus. And the next question that I was asked was, what are the 4 different forms of lupus? So the 4 types of lupus are systemic lupus erythematous. Number 2 is lupus dermatitis. Number 3 is drug-induced lupus. And number 4 is neonatal lupus erythematosus, which is the neonatal or the childhood form of systemic lupus. So systemic lupus is the most common type, and it accounts for about 70% of all lupus. And in that type, as I mentioned in the previous question, it affects any organ in the body. And then number 2 is the skin type of lupus called cutaneous or lupus dermatitis, and it accounts for 10% of all lupus cases. And the third type is drug-induced lupus, which accounts for another 10% of all lupus types. And it's usually a side effect of medication. And then the neonatal lupus, or the child type of lupus, is very rare, and it affects the fetus, and usually the mother has some type of antibody issue, and the baby can be born with a skin rash or liver problems or low blood counts. Thanks for joining me. This is Dr. Serena Satcher.